So I am Dr. M. Gauri Devi. I was the past president of IFS and I am the director of Gauri Hospitals Limited and Bridge IVF, Bridge Fertility Group. Here with me is our president of IFS, Dr. Pankaj Talwar.
Thank you, ma'am.
And he's the vision behind this program of patient empowerment program. So, Dr. Pankaj, my question is, how did this idea come to you in the first place? It is such a nice program. How did it come to you?
मैम आई थिंक इट्स ऑल ड्यू टू यू. जब आप प्रेसिडेंट थे और मैं आपका सेक्रेटरी था, तब भी आपने एक ही चीज़ सिखाई थी, आउटरीच. सो ये बात तकरीबन 7-8 साल हो गए हैं, बट आई बीन थिंकिंग अबाउट आउटरीच आउटरीच आउटरीच. तो मैंने पूछा था मैम कि आउटरीच क्या होता है. आपने कहा था कि गोइंग आउट एंड रीचिंग पीपल. और शायद मैम याद होगा, सबसे पहला जो मुझे टास्क दिया था एज ए सेक्रेटरी, वो था हमने वी विजिटेड 7 सिस्टर्स पूरे नॉर्थ ईस्ट के अंदर. मैम आप खुद ही ट्रेन पे गए थे, ट्रेन पकड़ के. यू हैड गॉन टू एवरी स्मॉल सिटी, शिलोंग, जोरहाट, एंड यू हैड डन मीटिंग्स देयर. आपको याद होगा मैम, सब कुछ आपने करा था उस समय. और तब से मेरे माइंड में था कि अगर मेरे पास कुछ पावर रिस्पॉन्सिबिलिटी की चेयर आएगी तो मैं आउटरीच को कंटिन्यू करूँगा. सो आज तो आपकी लगाई हुई है. बट आफ्टर when I had this opportunity, I had some idea, I had some thoughts I should do it, but कैसे करना है मेरे को नहीं मालूम था. तो ये like every incumbent president coming in, we want to do some lot of meetings and conferences and educate people. So I met Mr. Sarpati in the airport. We were waiting, flight was cancelled. like अभी इंडो की फ्लाइट सारी कैंसिल पड़ी. that time वो फ्लाइट्स पर कैंसिल्ड. तो मैंने सरपति जी को बोला कि कुछ ऐसा प्रोग्राम क्या हमें करना चाहिए, क्या इसका कुछ टेक रहेगा. उन्होंने बोला हाँ करना चाहिए. ही हैज़ बीन अ बिग सपोर्ट टू अस मैम. सो हम फ्रॉम नॉर्थ ईस्ट वी थॉट नाउ विल गो टू होल इंडिया, बिकॉज दैट टाइम मैम वी हैड ओनली 13 चैप्टर्स. और 7-8 साल के अंदर हमारा IFS बहुत बड़ा होता गया. एंड नाउ इट्स ए बिग बेबी. जो प्लांट आपने लगाया वो पौधा बहुत बड़ा हो गया. एंड वी आर नाउ द केयर टेकर्स. अभी वी गॉट मोर देन 29 chapters. We have got forums in UK, नेपाल, दिल्ली फोरम. तो हमने सबको आपस में बांधा और सोचा कि हम पढ़ाई लिखाई तो बहुत करते हैं, बट ऐसा क्या करें जब हम पूरे देश की सबको जोड़ के सबका हार्ट बीट को एक देश की धड़कन बना दें. और इसके लिए ज़रूरी था कि वी शुड रीच पीपल हु आर नॉन डॉक्टर्स. आर्मी बने आर्मी मैम, आई ऑलवेज फाउंड दैट हमारे देश में बहुत डाइवर्सिटी है. हम सब लोग 7 या 8 Tier 1 सिटीज़ में रुक के रह जाते हैं. दिल्ली, गुरुग्राम, मे बी पुणे, कोलकाता, मुंबई. इसके बाहर निकलते ही आती हैं Tier 2 सिटीज़. ये गिनती की 22-23 है. उसके बाद पूरा देश हमारा एक तरह से Tier 3 और छोटे छोटे शहर बने हुए
और विलेजेस.
अब उनके पास कैसे जाया जाए, तो इसके लिए फिर मैंने आपसे बात करा. सो थैंक यू सो मच मैम, आपने मेरी बहुत मदद की. आप और देन यू डिटेल्ड सरबजीत फ्रॉम जलंधर चैप्टर, आप दोनों ने मिलकर हमारी हेल्प करी. सो द एम वॉज रीचिंग पीपल इन दी विलेजेस मैम. एंड उनके पास जाने का एक ही तरीका है, और वो है उनकी लोकल मशीनरी को हैंडल करना. बिकॉज एंड दैट इज़ पेशेंस. मैम हम हमेशा अपने आप को ऑडिट करते हैं कि मैंने 4 पेपर लिख डाले, मैंने वहाँ पेपर पढ़ा, मैंने वहाँ पेपर पढ़ा, बट कभी हमने अपना रिपोर्ट कार्ड किसी से मांगा ही नहीं. और मैं कॉर्पोरेट में था, सो आई लर्न अबाउट 360 डिग्री अप्रेजल. तो मैंने सोचा कि हमारा अपना अप्रेजल भी तो होना चाहिए.
Exactly.
तो ये मैं आपके पास, और आपने मैम आई एम ग्रेटफुल टू यू एंड टू होल ऑफ IFS एंड सरबजीत फॉर टेकिंग इट ऑन. पर मैम मज़े की बात यह है कि मेरे तो माइंड में एक छोटा सा ढांचा था. आपने कैसे किया? आपने आई कॉल इट लाइक एन आर्मी प्रिसीशन. आर्मी में अभी जैसे ऑपरेशन सिंदूर हुआ था, तो आपने IFS के अंदर देश में पहली बार ये प्रोग्राम करें. एंड वी कॉल इट सेल्फ एम्पावरमेंट प्रोग्राम. यू हैड ए संदेश कमिंग आउट फॉर द गवर्नमेंट ऑल्सो. मैम कैसे किया आपने ये? आप यू वुड हैव हैड लॉट डिफिकल्टीज ना, इतने सब चैप्टर्स को कंबाइन करना, इतनी लैंग्वेजेस को साथ में लेकर आना. मैम आपने कैसे किया ये?
Yeah, it was not an easy task, but you had made me the national advisor, and I had a good team with him, and I cannot thank Sarabjit enough. I wish he was here in this conversation. He was the convener, and he did a lot of work. And all the chapters, we had included about 15 chapters. And then all of us,
15 all of the country, you got them together?
Yes.
Wow.
And we together sat, and on Zoom meetings we decided how to go about it. And then with your guidance, what we thought was, let us reach into the outreach, as you rightly said. So we got contacted the CHCs and PHCs, all the ASHA workers. Believe me, Dr. Saab, we had about over 1,500 health workers and ASHA workers were involved in it.
1,500.
100. And then we made videos, flip charts, as well as, the main problem was language. Language barrier was there in the sense how to outreach the villages of Bihar or Chhattisgarh. So we made in different languages, and 10 languages were used because many places Hindi was common. So Hindi, Himachali, Bihari, Gujarat, and Vidarbha, Andhra Pradesh, Chennai, all these languages, we made flip charts. And then health camps, these were organized, and people, very nice, all the chapter secretaries I am very grateful to, and they made these flip charts, went to the PHCs, there a health camp was held, and the ASHA workers were trained in the sense, we can do one health camp. Now they have to propagate it further. So these flip charts were left with them so that they can keep teaching them. And what I feel is, women empowered, you empower the family because she can guide all the women in the family.
Correct.
So that was our vision, that we should empower the woman. They should know when to approach a doctor. They are scared. The multimedia, they propagate so many things. So if we have our own media or we have our own videos, they know, okay, these are doctors and they will guide us. So they can go to the nearest center and take this thing. That was our vision, and we tried to execute.
Ma'am, you made a lot of videos also. You had some themes like menstrual hygiene, PCOD. ये thoughts कैसे आपके mind में आए?
We thought that we'll take the common things.
Okay.
ठीक है ना, हम लोगों ने लिया PCOD.
तो आप हट गए. You left fertility in the background, and I think that was the biggest thing ever done. I think हमारे जो प्रधानमंत्री जी ने उनका विजन रहा है हमेशा कि अखंड भारत आपने वो करके दिखा दिया. और जब आपने मुझे बोला कि fertility is a small part of it, let's go and look at the whole woman in totality. I think this was the most beautiful thing you did, ma'am. तो उसके बारे में बताया मैम. तो वो अपने फिर as such a senior infertility doctor, we are one of the most senior most doctors of the whole country. How did you get all these things together? PCOD, menstrual hygiene.
We took the common problems.
Poor Women Reserve.
Exactly. We took the common problems actually. In Poor Women, we went into menstrual hygiene, fertility myths. Many of them
are very super hit for what you did.
And another thing was breast cancer, cervical cancer.
Okay.
And menstrual hygiene.
Wow.
So these were the common problems women face, and many of them, in the villages and in the third-tier cities, they don't bother. They have white discharge or they have a lump in the breast. They don't approach a doctor. So we were spreading awareness that you can palpate yourself. Please go to the nearest doctor. That way, all the common problems were.
Correct. मैंने सुना कि कई बार आपने मुझे बोला कि जब आपने कैंप्स करे, आपने कैंप्स कश्मीर के अंदर करे, जम्मू में करे, कई बार तो सुना मैंने, आप लोग बताते हैं कि कई बार तो गन फायर की आवाज़ आती थी, पीछे गोली चल रही होती थी. एट द बॉर्डर यू हैव डन द कैंप्स. और कश्मीर के अंदर आपने पूरी बर्फ़ के एटमॉस्फेयर के अंदर छोटे छोटे शहरों में जाकर अपने कैंप्स करे. ये कैसे किया? आपको घबराहट नहीं हुई कि आपके डॉक्टर्स डरे नहीं वहाँ कैंप करने से?
नहीं, these PHC, CHCs, that we are well protected. Number one. So that is not there. And actually, Dr. Pankaj, Kashmir was one of the highest attended camps.
Okay.
It was full. People were very, very, very forthcoming.
छोटे से गांव में किया जाकर आपने with police security के साथ किया आपने. I think you also got some big MP also came and inaugurated that.
Yeah, he came and inaugurated
that.
Yes. And it was one of the very well attended camps. It extended the whole day. They had to shut down the camp. It was that busy.
Okay.
Yes.
और एक और आप चीज़ बताते हैं कि जब लाइट ही नहीं होती थी और सब डॉक्टर्स आपके गर्मी में बैठ के पसीने और कैंप क्या करते थे.
Some of the camps there.
It happened.
Yes, this did happen. Okay. But the doctors were good. They carried on. The ASHA workers were good. Everything went smoothly. We tried to convey this message to them as much as possible. Those who are educated, all these videos are uploaded in our website. They can anytime go look at it. And flip charts were left in these centers. A number of them were given. We had asked ASHA workers to distribute it further.
Correct.
So that, the process goes on.
Wow. तो एक और चीज़ which Dr. Gauri did along with Sarabjit was not only looking after the fertility part, but looking at the whole woman in totality, cervical cancer, breast cancer, but I think the icing on the cake जो आपने किया that was your operation Sandesh. Sandesh, Bengali Sandesh या Sandesh we call it. जहाँ पर you wanted to, there was a time when the new rules were coming, ART Act was being formulated. So you made a very nice booklet for the local chief medical officers. वो क्या किया था आपने? How did you manage that? और उसमें
We got it all printed, you know. As you rightly said, Satpathy had a role in it.
Yes.
All these flip charts and all these videos were made by them. And we made a book of the ART laws. So that, you know, that booklet is spread all over. And they should know what are the legal limits at which they can work. So that was given to them. And yes, it was a stupendous talk, but we could manage it.
So you not only educated the women about their health, you also educated the primary healthcare workers, Anganwadi, Asha Didis, 1,500 of them, and you also educated the health authorities about what we are doing as gynecologists.
Exactly.
मैम आपको लगता है कि कुछ आपने impact छोड़ा, or just an exercise in fertile?
No, I don't think so.
आपके KPIs क्या थे मैम?
जब वो कैंप्स चल रहे थे, it was a very forthcoming thing. You should see those women who have come from far, sitting there. As you rightly said, it was so hot, they are sweating, sometimes there was no light, but they were sitting there just to know what it is all about. So they definitely are, you know, benefited, and by leaving the cards and by leaving the flip cards and videos and health camps, they can propagate it further. I wish the future generations also keep doing it.
Carries on.
So that, you know, it cannot be just we did one and it will have a lasting impact. Future presidents should carry it on. That is my wish.
So it was a duty towards the country which you performed, ma'am. Ma'am, I also heard and I also saw one lovely white paper which you had made.
Yeah.
That white paper, I think you gave a message to Government of India, and you put it on multiple portals.
Yeah.
What all you did, ma'am? So what is this white paper all about?
What was it was what we did. We wanted to project it to the government and tell that this is a good work. And here we have not taken any government aid or anything. So if they support us, we can proceed, you know, and do much more. And we can go into the interiors and mention them. You see, it is very difficult from villages. Routine tests. I don't think if you go to a village in Bihar, if they want a pap smear done, Dr. Pankaj, they have to go for 550 to 100 kilometers.
Is it?
Yes. Okay. To get a semen analysis done, they have to travel 50 miles. So these are the things, you know, I wish government is with us. We can do much more on this thing. I wish we could do it.
How did Dr. Chandra Prakash take it? I know you're very busy that time, and it wasn't a small exercise. How did sir support you?
Oh yeah.
Here he's so many full of ideas. How did he support you?
He always in my career supported me. I was one of those lucky women. It is not usual that the men support.
Knowing you,
like
he's
that.
a lucky one.
No, I wouldn't say. He always supported me. Never ever said, no, you sit at home. Never. He always, and he gave me ideas also. Oh, this is the way you can go about. So he was a great support.
So ma'am, thank you so much for being with me. I think without your support, it wouldn't have been possible. And any message for the IFS members, for a countryman, for our government, any message you have for them?
Thank you, Dr. Pankaj. Actually, without you, probably we couldn't have done so much. And my message will be, as I told before only, IFS should carry this project forward. Keep outreaching so that we spread our message not only just about fertility. Yes, fertility is a problem. You know, the national fertility rate is going down. Okay. And it is in metro cities touching below. So we have to take infertility as a disease, and we should be able to propagate further and further so that we are able to outreach to all the third tier cities, villages and people. And we are IFS as a body, because we have a large reach, as you said, so many chapters, every willing worker, good team. We should be able to propagate it further and further so that, the women are empowered,
Empowered.
and nation is empowered.
When women are empowered, then I think we move forward.
Nation is empowered.
Thank you so much, ma'am. It was really my great honor to be with you today. And always need your blessings. And thank you so much for blessing IFS.
Thank you, Dr.
Thank you.
Pankaj.